I'm going to discuss the palpation of wrist. So basically the wrist palpation is divided in two parts. One is your posterior wrist palpation and second is your anterior wrist palpation. So let's start with the posterior wrist palpation. So again, let us start with the position of the patient or position of the part. So as you can see that the forearm and hand should be supported over the top of the table like this position. Again, the palpatory process starts with the localization. So for localization, we can use any landmark. Here we can see it is basically ulnar stellate process, and at the lateral side, here we can palpate the radial stellate process. So both landmark could be used for the localization. So let's start with the identification of the radial stellate process. So here you can see this line is already here, and basically it is representing the joint line. Okay. So first of all, identify the radial stellate process. It is a bony prominence just proximal to the wrist or the lateral side. So first of all, identify the radial stellate process. Place your thumb pad like this, then slide it distally towards the thumb. Ultimately, you will reach in a depression. You can see the movement of my thumb pad. It is a bony hardness, and here it is a soft tissue filled depression. So this area is basically called the anatomical snuff box, which is here you can see these are the line which is already drawn here. This line is representing the tendon of extensor pollicis longus. Let's extend your thumb. See, the tendon is getting prominent. Here at the just anterior, or you can say anterolateral aspect of the radial stellate process, here two line is drawn, and basically these two line is representing the tendon of your extensor pollicis brevis and abductor pollicis longus. So basically these three tendon form the boundary of anatomical snuff box. Two tendon is here and one tendon of extensor pollicis longus is over the little bit medial side, and at the base it is the radial stellate process. In this depression, if you apply pressure towards the medial side or towards the ulna, you can feel the bony, small bony prominence, which is basically found because of the presence of your scaphoid. For the confirmation, if you want to feel it clearly, so just apply the ulnar and radial deviation. While performing the ulnar deviation, this bony consistency is coming out. It is clear cut hard bony consistency I can feel underneath of my thumb pad. So this is the location of your scaphoid. Next, just change the orientation of your palpating thumb or finger. First, I just slide my thumb pad like this, and I identified the location of scaphoid. Further, and this is the first bone of your proximal row of the carpal. From here, you have to change the orientation of your palpating thumb. Now it is directed toward the thumb, and slide it little bit more distally, and again just identify. You can easily identify another bony landmark, that is your trapezium, which is the first bone of the second row of the carpus. Okay, so these two bony landmarks could be identified over here, in especially in the anatomical snuff box. Further, if you move more distally, ultimately you will find the first carpo-metacarpal joint. For confirmation, just passively perform this movement and you can appreciate or you can feel the movement at the base of the thumb. So this is the location of your first carpo-metacarpal joint. Basically, the complete wrist could be divided in three different parts. First is it is radial column, which is you can draw a line from here. So just adjacent to your index finger, three carpals come in the radial column. In center column, which is basically formed at the base of the your middle finger, here you can find two of the carpal bone, that is capitate and lunate, and in ulnar column basically again there are three bones. From the posterior approach we can identify only your triquetrum and hamate. From the anterior side we can identify the pisiform. So this is the location. It is here again I have already marked. This is the location of pisiform, and just posterior to the pisiform this is the location of triquetrum. So again let's start from the radial column. We have already discussed the location of scaphoid and trapezium. From the trapezium, you have to slide your thumb pad little bit more centrally, and ultimately you will feel a gap that this tendon is also passing from here. Here, this is the location of your trapezoid. That is the second bone of the distal row of the carpal. So these three bony landmarks can be identified in the radial column. This is the lateral approach. Here in the anatomical snub box we can identify the scaphoid here. But if you are trying to identify it from the posterior side, so it will found just distal to the posterolateral aspect of your wrist over here. So this is the again this is the location of scaphoid. From here we can identify the scaphoid, and from here we can also the aspect will be different. Okay. Now come to the come in the center column. Center column is basically found at the in the line of the middle finger. So first of all again identify the, you can slide your finger pad like this, identify the head of the metacarpal, slide your thumb pad more proximally, and ultimately you will reach over the base of the third metacarpal. From here again you can see this line is drawn over here. Basically it is representing the carpo-metacarpal joint. Okay. So just slide your thumb pad from the base of the third metacarpal more proximally, and ultimately you will find a depression. See, this is the movement. You can see the movement of my thumb pad. It is coming here and it is going in. So this is the location of your capitate. Again for the confirmation, you can perform passively dorsiflexion and palmar flexion. While performing the dorsiflexion, this bony consistency is disappearing. Means your capitate is moving anteriorly. When you perform the palmar flexion, then this bone is bulging out. Again it is coming in posterior direction. So the consistency will appear again. So this is the location of your capitate. Again from the capitate, it is marked over here. From the capitate, you have to slide your thumb pad about 1 centimeter or less than that towards the ulnar styloid process. Little bit ulnarly. And here you will again find another bony landmark or bony projection. This is the location of your lunate. Again whatever we perform to identify or for the confirmation of capitate, the same movement we can perform to identify the lunate, like this, and the same feature will be identified as we found in the capitate. While performing the palmar flexion, this bone is bulging out posteriorly or coming out posteriorly. While performing the dorsiflexion, it is going in, means the bony consistency is disappear. So these are the two bones which we have already marked here, and this is the process of identification. Now come to the ulnar column. So this is the location of ulnar column. Basically your little and ring finger in the line of these two fingers, if you proceed toward the wrist joint, after the base of the metacarpal, this is the location where we can identify two bones. If you start your palpatory technique by the localization of ulnar styloid process, so first you will identify the third bone of the proximal lobe. Third bone means your triquetrum. Okay. So first of all, identify the ulnar styloid process, then slide it towards the little and ring finger. Here you will find a gap between two bony landmarks. This gap is little bit less, but if I tried another approach, means I am placing my thumb pad over the medial side of the radial styloid process. If I start my palpation from here, ultimately I will reach in a gap, and basically this gap is the location of the articular disc. After this gap, ultimately we will reach over the bony prominence again. So from the posterior side, it is the location of your triquetrum. Same time, basically I am making this grip, and you can see my index finger is already over this landmark, which is I have marked already. So if you are making your grip like this, just posterior, just anterior means this is the location of your triquetrum, and same time if you are making a grip and you are placing your index finger over the anterior aspect of the wrist, automatically you will reach over the pisiform, and it is very easy to identify, but we will discuss in anterior palpation technique how to palpate. So these are the two bones of the proximal lobe, third and fourth. Third is your triquetrum and fourth is your pisiform. Next, it is little bit difficult to identify the hamate. For the identification of hamate, first of all you have to identify the fourth metacarpal, slide it down, and ultimately identify the base, which is already marked, carpometacarpal joint, and slide your thumb pad more proximally. So this is the location of your hand. So this is the posterior palpatory technique for the identification of your wrist, or especially the carpus bone of the wrist. Okay.